pleasure to welcome Mark Owens. He is the Executive VP of Blue Cross Blue Shield, Michigan. Mark, it's a pleasure to welcome you.
Thank you. Pleasure to be here.
So if individuals take care of their own health management, how does companies like Blue Cross Blue Shield help them?
Well, we end up in a couple of ways, I think. There's a number of services. We're going to have to change. What we do today will not be what we do tomorrow, in my view. But we have the ability to bring massive amounts of information because of all the members we covered today, and be able to provide them with information. It's not easy to do today. That will help them make those choices to understand. We can bring together other services, programs, what have you, that they might not otherwise be able to access themselves, just they wouldn't be able to find them, or it would be hard for them to find it. But by aggregating all the people, we can say, well, here's a service that you can buy that is important to you. We may be a financing vehicle as a possibility. Those are just some of the ways that I think that people are going to need help in making a choice, figuring out what level of risk they want to take. Once they make that decision, figuring out or helping them figure out which product plan to buy, what other things might they want to consider, what other kinds of benefits or services are important to them.
You know, medical insurance is only next to losing a home. It's so scary for people. Mm-hmm. It's worse than losing a job. And because of that, 45 million plus Americans are uninsured. Mm-hmm. Those who have insurance but can't afford the premium, they prefer going across the border, either south or north, or going to other countries outside. How do you think we can, try to lower the cost and make it more manageable for, millions of Americans?
Well, I think there are a couple of things that have to happen. First and foremost, I think, is we have to find ways to eliminate unnecessary or wasteful services, whether that be fraud that occurs, or just the fact that the fragmentation we have today. You have people, and I know people personally, who will go from doctor to doctor to doctor and have the same test run multiple times. And that happens in today's world because the fact that there's a test and there's certain results from that test are sitting in a paper record someplace in one provider's office that's not accessible to the others. So we have to find a way to provide the data in a central place or access in a way that's accessible so that providers see that it was done and go, no, there's no reason for me to run that extra test. And then quality outcomes. Again, you think about if I treat you, but I really don't treat, I misdiagnose you, or I don't really appropriately treat the situation, you could end up being rehospitalized. We have a real problem with readmissions to the hospital. We got to drive that down. That's millions and millions of dollars are spent on people who within the first 30 days of discharge are back in the hospital, first 60 days back in the hospital. Quality, and it's not that the care they receive in the hospital wasn't quality, it's that when they're discharged, there's no good, smooth transition. That's a quality aspect back into the community, and they end up having a relapse and they're back in the hospital. It costs us lots of money. So quality is I think, a critical component of it, and eliminating, to the extent possible, the variation in practice patterns, because those things can drive costs too. Where a number of years ago there was a study done by a reporter from the Sacramento Bee, had to do with women and hysterectomies, and the correlation between the likelihood of a hysterectomy had nothing to do, or little to do with the diagnosis, and more to do with the zip code that woman lived in. So that was, he did this extensive study. Peter Orszag, who prior to taking a position in the White House with this administration, was the head of the director of the Congressional Budget Office. And he did a study on Medicare a number of years ago, which is really telling that we spend $16,000 a year on the average beneficiary in South Florida, and let's say $4,000 a year on a senior in Detroit, and yet the quality of the outcomes, no different.
For entrepreneurs, this is a big cost, and it's a requirement, absolute requirement. So in the life cycle of an entrepreneur, pretty soon after you have a startup, you have to start thinking about medical benefits for the employees.
Mm-hmm.
Are there any initiative strategy you put in place where entrepreneurs could be roped in and make to understand that there is a feasible, better economical alternative?
Well, I think typically in today's world, an insurance agent or insurance broker or whatever word you want to use often serves for a small organization like a startup or an entrepreneur as kind of the HR department, the benefits expert. And I think that it's very important, entrepreneurs ought to find someone like that they can trust, who will educate them and help them make the right decisions. Because there are alternatives, I think, available. Unfortunately, in like any industry, there are people in the agent community who are driven by their conditions, how much they get paid, and they may steer someone to a product based on that. But there are a lot of them that are not, that are driven by truly wanting to help people. And so, just like in the financial services industry, right, there are people who sell based on commissions, and there are others who will help you, advise you on what investments to make. There are agents that can do the same thing, and I think the entrepreneurs should find those people and treat them, as a partner, if you will, in helping make that decision. Because depending upon the nature of their business, in terms of the makeup of the employees, there are plans that are less expensive, perhaps, that will provide the peace of mind that people want.
Well, thank you for sharing the time and the opportunity, for giving us to talk to you.
You're welcome. My pleasure.